Patrick Ellis, President and CEO of the Murrieta Wildomar Chamber of Commerce here, wanting to do a little bit of an update for everyone. I know that now we've got not quite a week under our belt of reopening, but we're getting there. And I know that there's a whole lot of questions around reopening, whether you're an office, a restaurant, a retailer, or what have you. So with me today is Daneen Ashworth with Meridian Payroll and HR. And so I'm going to ask some questions to Daneen. We're going to have some discussion regarding some of these different issues that some of you might be facing right now. And, you know, hopefully we'll kind of be able to answer some different things for you. And if not, obviously you'll be able to kind of, you know, contact either Daneen or another HR person that you have a relationship with where you can get some more clarity on some of these questions to protect yourself as a business owner or yourself as an employee. But know that, you know, most of the business owners that we know out and around here are really looking out for their employees and trying to do their best. And this is kind of a team effort. And, you know, even us as the chamber, we're looking at, you know, re-entering our offices and start working from there too. And so we have to kind of look at some of these different aspects as well. So Daneen, thank you for joining us. Appreciate it.
Thanks for having me.
So I'm going to go through, I've got some different questions here kind of set up, but, you know, we may end up on some different tangents, which I think is completely fine. But so let's kind of just start with the basics. So we're into that kind of reopening part. People are, you know, contacting employees to see about coming back, to setting up new schedules, these different kinds of things. Maybe kind of from your perspective, where does the business owner or manager, where should they start as far as, you know, first kind of engaging with their employees that maybe have not been around for the last few weeks or so?
Right. So once you've determined, number one, you're allowed to open. Number two, that you're ready to open, you know, we're going to look at restaffing. We're going to look at recalling staff if you've had staff that have been furloughed or laid off. And a lot of that is going to depend on, you know, did you completely have them off payroll? Were you covering some of their benefits during that time? A furlough usually has an end date, but people have really at this point in time been using those terms very interchangeably. You know, so they're going to look at things, you know, that it may be just construed as a complete new hire. But the first thing to do, and everything really should be documented, is to, you know, congratulations, we're opening up the workplace. Here is the schedule. This is when we want you to report. And then give them an option to, yes, I want to come in. No, I don't, or that's not going to work. You know, some of the times we're finding staff are not wanting to come back in for various reasons. And then we need to send a second correspondence letting them know, well, work has been offered. Your benefits from, you know, unemployment may be in jeopardy because of that. And encouraging them, we're safe. We're trying to be as safe as possible.
And I think that's a really good point, because I've heard that a lot, obviously, with the discussions I've had with some of our local business owners. It's a discussion we've had on the county's recovery task force meetings of this, you know, challenge that there are some employees who don't want to come back. One, because they're either making more money on unemployment than they were before, or that they're still not comfortable yet with the surroundings and what's going on. And that's why I said I think that you know, you make that great point is that we have to have this discussion between employer and employee, that there is this discussion and working together to make sure that they are working in a safe environment, right?
Absolutely. Yeah.
And I think that, you know, that the other point too is the whole issue with the unemployment, when you've got someone who's making so much more because of all the federal dollars that are being put into it and everything now. You know, I think that employees need to understand is that, you know, businesses want their employees to be back. A lot of businesses consider their employees like family. And they want them to come back and they want them to be productive in their business. But at the same time, we're at a point where people are trying to get back to this new normal, and there's got to be, you know, there's got to be a point where an owner is going to make that decision, and employees got to realize that you could get reported to EDD and you lose those benefits, and not only lose those benefits, if you've been collecting them, you can get fined on top of them. And people, they need to understand that this is a big risk for them to take.
Yeah, absolutely. And then the employer, because they've refused the work, is going to need to hire the next person on their list or hire outside. And then there's no job to come back to. Plus, those benefits have been removed as well. You know, it's a tough spot.
Yeah, and that's with, you know, the actual number being 20% unemployment at the moment, which is an arbitrary number because we know a lot of those are people are going to come back to work. But still, there's a lot of people who are going to be looking for a job. And so do you want to jeopardize that job for the long run? You know, I mean, that's a decision. You know, speaking of those that you are then looking to bring back, you know, if a business owner is, okay, I'm going to start bringing back employees, but I'm only going to bring back a certain percentage of them or what have you. You know, how does the employer kind of go through that? Do they get to pick and choose who comes back? Is there a protocol that they have to follow? How does that work?
And that's going to depend too on how they were let go. Was it just, okay, I'm not giving you hours right now because there's no hours to give, but there was never a clear separation in, you know, from the company? Or was it, here's your layoff papers, we'd like to bring you back, but if we can't, we can't. And in that case, there is a separation. We need to, you know, we can look at things, we need document. We need to make sure we're not discriminating in any way. But if it's been a clear-cut separation, we can look at our top performers as long as we have data to support why we brought this person back instead of another. A lot of my clients, the staff, are having to do, because they're not bringing everyone back, they're only bringing a certain number back. And so those staff that come back have to have the capability of filling in several different roles for the company. And so we're going to look at those people who are have those qualifications or have those certifications or whatever is required. But as long as it is, you know, we've got a job description that says this is the new expectation, and this is the employee I chose because of these expectations, you know, it should be, I can't say 100% safe because it is California, but you know, you do have some protections there.
Very good. So now we get to the point where we're talking, okay, we're looking at reopening. And I know, like last Friday when we got the notice, you know, from the state that Riverside could reopen. So I jumped on Facebook just to get an announcement out there as quick as possible. But the one thing I did know to make sure to say in that announcement, and which has been critical, and most businesses have taken this extremely seriously, is you have to put your plan in place. You have to have a safety plan. You have to have training with your employees. You've got to have a written plan on all of the different protocols and cleaning procedures and those different types of things. And I think that's why there are some businesses that are just opening, you know, today or not even until June 1st, because they're still working on that. And so we've got to be patient with those businesses as well. Kind of give me an idea, and everyone else here, I think some businesses have a really good idea of what that plan is, but I think others are still kind of like, I'm not sure exactly what kind of plan I got to put together.
Right. And every plan has to have the capability of changing. You know, the information that's coming at us on a daily basis from the CDC, from the governor's office, everywhere, it's really constantly evolving. And so the first thing a business would need to do is do a risk assessment. Where are the areas where an employee might come into contact with the virus or might, you know, get the virus somehow, and look at how can we mitigate. We can't eliminate some of them can be completely eliminated. Some of them we're just going to look at mitigating, and what things are we going to do. The California Department of Health along with Cal OSHA put together some industry specific guidelines to really help employers through that process of what things do we really need to look at. And then we do need to train the staff on, you know, there are things that the governor's office has said, these things absolutely have to be trained to the staff before they can start. And it has to be documented, the training, and, you know, they have to sign in and sign out and say that they have, not to mention, you know, the disinfection protocols, what products we can use, what products we can't use. There's certain things that are approved for coronavirus and certain things that aren't effective at all.
Yeah, and you know, as we had talked a little bit too prior to this was, you know, that you have to have kind of this, sanitization plan in place. But it's not just for you and your employees. I mean, if you have janitors that come in on a nightly or a weekly basis, you've got to have a plan for them as well, right?
Yeah, absolutely. I know my husband and I, we've taken it upon ourselves to be cleaning and sanitizing for right now at our company. Just that's what the staff felt was, they didn't nominate us. They didn't volunteer us to do it, but they didn't feel right about having more outside people coming in. So for us, we made that decision, and we want our staff to feel comfortable and safe. So we're going to take care of it on the weekend.
Right. So, talking about, we've got all these different new written plans and things that we have to kind of account for. So for companies, do they have to now look at, all new handbooks? Do they have to look at do they have to change some of their different, depending on the type of business manufacturers, you've got your different iOS, systematic, systems in place and things, how does that change? Did those things all change as well, or are these things that are just added to?
Now, what I'm doing is I'm not changing the whole handbook because, my hope, and I try to be an optimist, is that it's not always going to be like this. I mean, I know we're always going to be dealing with it at some extent, but I'm doing an addendum, or just as an infectious disease control policy specific to that office. What are your controls going to look like? What are your engineering controls? What are your administrative controls? What things are we going to have? There's all kinds of different, I don't want to get in the weeds in this, but there's all kinds of different things that we can look at for protecting our staff, and standards that we're going to hold our staff to. We know staff can get a little jokey with each other at some times, and we have people very afraid and people not afraid at all. I don't want to see someone who's not afraid at all and thinks everything's a joke pretending to cough on other employees.
Right.
We want to be able to hold them to a standard and expect that is carried out through the workplace.
So kind of along those lines, we're going back to the employees a little bit. So there's, some different things that kind of, there's been a lot of talk about, and I think this applies to not just coming back to the office or to the business, but then also on a regular basis. So, there's talk of, whether you have to get a test or not, or, temperature checks, if you have to wear a mask or not for an employee. I know it changes. Kind of maybe give us a generalized idea of what do most businesses, or what are the expectations of most businesses, both from the employer and employee standpoint. And we know everyone's going to have to make their own plan specific for their business.
Mm-hmm. Yeah, so as far as temperature checks, we actually are able to temperature check our staff as they're coming in for the day. We have to keep some things in mind, though. We have to be very careful with HIPAA compliance. So I would not recommend keeping a log of everyone's names and everyone's temperatures. It really needs to be not written down, because then if someone else sees that, you violated their HIPAA rights, their HIPAA privacy. And as they're coming through, we're not going to say, Joe, you pass, come on in. And, oh, Sally has a fever, go home. And if they're lining up for a temperature check, most people are doing the forehead ones. If they're doing it, that time in line waiting to get in is compensable time. Mm-hmm. So we have to figure out maybe alternate ways of timekeeping during that time, so that we don't run into then a wage and hour violation when we're really just trying to protect our staff. Other things you can do are ask employees to self-monitor at home. From my understanding, and again, remember, I'm not a doctor either, but some people don't even have a fever when they have this virus. So I'm not completely sold on the temperature checks, but if some of my clients are doing them, and I just warn them to please be careful that, I know some people are outsourcing and having an actual nurse come in, and actually for the larger companies doing those and making sure that everyone's okay. And then just at the end of when everyone's done, okay, yes, everyone passed, check mark, and that's your documentation, not necessarily each employee separately. And if you have an employee who comes in with a fever or who comes in with symptoms, we have to look at reporting time pay. They do need to be paid for half of their shift, and some other, again, this stuff I could talk about for hours, but I won't, I promise.
So two things that come out of that. One has to do with kind of the liability issue, which I think I'll bring up in a little bit. But there is obviously too with that. If you're not temperature checking, there may be a liability issue with it too. Both whether it's employees or customers, there could be some liability issues there, which we'll talk about in a little bit. But you know, the commensurate part is interesting because I've seen both now as where there's temperature checks when you first get to work, and it's done while you're there and on the clock. But I've also seen, I know Target does a thing where they pay all of their employees 5 minutes of work time prior to leaving their house, and everyone is required to take their temperature before they leave their house, which I actually think is kind of smart, because it's like, why would you want them there to take their temperature? Let them take it at home. And yeah, it's still a self-diagnostic, but then I think you also get into that issue of, well, they're kind of, you know, self-testifying that they're fine, and so they've agreed to that, and then it can get you by the issues as well. So I think there are some different ways to do that, depending on how your business is and runs and type of thing. So
absolutely. And to talk about the face masks a little bit, I could not imagine something being so controversial on this planet.
Yeah.
And to involve so many passionate emotions. We try to steer clear of that. And really, the business owner really needs to determine what is going to be your policy. And you need to look at some of the industry specific guidelines, say you have to wear them. They are required in some industries. In some industry, and we've got the county supervisor saying that they're highly recommended, but not mandatory. So we've got some conflicting kind of legal information, and I really would just tell the business owners to ascertain what would be the best for the health of their community, for their people. And we have some employees who are very fearful and some who are not, and really just trying to find a way to help people feel safe, to keep people really safe, you know, in a way that is their policy.
Yeah, I think a good way to kind of think about that is if you're the employer and you own your business and you have people who are coming to your business, whether retail, restaurant, what have you, and your employees are helping them, regardless of whether you think masks are good or not, is that it's kind of your, it's your requirement to keep your clients as safe as possible. You don't know for sure if you yourself or an employee are sick. We know that there is that possibility, that you could be a carrier without showing any symptoms whatsoever. So would you not want to make sure that you are doing everything possible to protect your clients and your customers? And that's why most businesses are taking that stance of we're going to require masks because of that. We care for our clients and customers. That's why, not because of, individual freedoms and all these other things. We're trying to protect everybody involved, especially our customers and clients, because if we were to get one of them sick and then that gets out, that could destroy your business in some regards. So depending on the size of your business. So.
Right, and absolutely. And you talked about the COVID testing. I know countywide, we're really trying to get a lot of people who are asymptomatic out to test to show that, get that baseline for the percentage of people who are actually, testing positive, given all the negative tests as well. Employers, some have been requiring that COVID test. I haven't heard a lot about whose responsibility it is to pay for it. In my, thinking about California law and labor law, if the employer is requiring it, there might be a question of who needs to bear the expense of that. And, that's just going to be up to the employer. For me, I think it's important that a lot of people get tested so we can change, get open a little bit faster and change those numbers. But as far as from an opening standpoint, like, okay, we're safe, someone could be tested and then maybe get it the next minute. I don't know if it's completely indicative of safety.
So, and we kind of even skipped over what is really the most basic rule of them all right now with the reopening is if you're sick in any way, shape, or form, stay home, regardless. Doesn't matter. But
No
that does
more.
add to the question. So if someone is sick and
Mhm.
stays home, do you as an employer now ask that person to go get tested prior to returning to work because they were sick, whatever it might be,
Mhm.
just for precautionary measures? I mean, I can speak to the who covers the cost right now part. I don't think either one of them have to worry about that, and I'll
Right.
explain that in a second. But I think the question is can an employer require an employee who is sick or calls out sick, can they require them to go get a test prior to returning to work and have to wait for a negative result?
And this is kind of a new temporary thing that employers are allowed to do, is we are allowed, if someone does end up sick or reports symptoms and doesn't come in, we can ask them to make an appointment with their medical provider. And they're going to make that, and mostly likely it's going to be a telehealth appointment. And then that provider is going to say, call me in 24 hours, quarantine for 2 weeks, go get a test. That's going to be needed to be decided by the medical professional. And then the employee is going to communicate with the employer. And the employer, then it's just going to be this communication, and it's going to be dependent on what that practitioner decides. As far as, I mean, if it is a fever and maybe it's 105 outside and they were running from the car and you got swiped when you came in and your temperature was up, well, probably because it was hot outside, and the employer's going to say, okay, make sure you don't have a fever for 72 hours without fever reducing medication, and then you can go back to work. And we can't necessarily require certification on that, but we can require the name of the provider, the practitioner, and
Gotcha.
keep that. And there's different leaves. I don't know how much you want to get into those, but that's a whole other topic.
I'm sure there is. So, but yeah, and just so everybody knows, as far as the testing part goes, I forget the number now offhand. It's 12 or 13 different test sites around Riverside County. I think 8 that are set up by the state, and then 5 or 6 that are set up by the county themselves. All of those tests are free. There's no charge. No matter what your status is, who you are, where you're at, you just have to register, provide your address. They'll ask you for insurance. Insurance will pay for it. If you have insurance, I encourage you to use the insurance, because then it stretches out those CARES Act dollars to get more testing down the road. But it is important to get as much testing done as possible. And it's very quick. I did my test on Tuesday and got my results this morning. I'm negative. Whoop, whoop.
Woo!
But it's very easy, very quick to get done. So let me kind of shift into our last little part of the discussion, which is this liability discussion, which is not a fun discussion, because obviously I think, if you've been on social media for, any bit of period of time right now, you're already starting to see some different ads and stuff from different attorneys and what have you, kind of helping to cover you in this, if you haven't been treated right during the COVID age. But I think that there's a lot of concern from business owners. Obviously, there's a lot that are going back and opening, but there is a lot of hesitation because of that. And there is still discussion going on in Sacramento. But kind of like, obviously we want employers to do the best that they can. I think that, kind of what a lot of what we've talked about sets them up for putting them in as best a position as possible. Kind of, what would be your last thoughts around that kind of liability stuff? Obviously, we're going to still advocate, on a statewide level and a federal level to get some liabilities for ownership. But, what can owners do and to protect themselves as much as possible right now?
So as much as possible, we want to make sure we have great policies in, not just a written policy, but actually execute the policy. Do what it says. It's not just enough to say, well, have the poster that says wear your cloth face covering, but no one wears it, or, we've got our nose and mouth hanging out. That really doesn't offer a lot of protection. If you're going to require it. If you're not, then don't. Make sure we're documenting when we're cleaning, what we're cleaning with, who's doing the cleaning, on what intervals. We just want to make sure, the best thing to do is just to have great documentation, to follow the rules to the letter as much as you can, and to also make sure that we're following the old rules, the clocking in and clocking out and the meal breaks and things like that. We want to make sure people are safe, but we want to make sure we're covering our businesses to make sure that we're looking at those things. Maybe make sure you have a paid sick leave policy. Make sure you know about the leaves of absence. Make sure, and now the labor commissioner federally has said, or the Department of Labor, the labor secretary has said there's 93 FAQs just based on the leaves of absence that were given out by the FCRA. And so, there's a lot of ways that we need to be covering. And really, like, I've been trying this whole 2.5 months, trying to kind of think, well, what's the next thing, and trying to be ahead. So I'm ready with that policy or that kind of event to make sure that, my clients and employers in general, I'm a strong believer in small business, but we have to be on our toes. We have to kind of be looking for the next thing to come out.
Yeah, and I think that's a great point. I think kind of, business owners and managers need to kind of maybe be a little bit more flexible and kind of just forward thinking as far as that ability to, give a little bit more to the employee benefit at this point, right? So especially like with breaks, right? We know what mandatory breaks are, we know what requirements are, but you're now asking employees to work with masks and around different people. So give them the opportunity to go and take a break to wash their hands or change their mask or do different things, because it's going to help you in the long run to avoid some of these possible liability issues down the road. And again, I think the more you're working with your employees and creating a strategy together, the better you set yourself up in that regard.
Yeah, absolutely. Be open to the employee suggestion. Our employees have great ideas. Make it an open door, have an open door policy really for anything, but especially now, really be willing to listen to your people.
Very good. That's a great bit of advice. So Daneen, if somebody has a question or wants to reach out and find out, I know that you've got some different things that you're helping businesses just provide very, cost effectively or giving away some different things, some tools, at no charge just to help protect everyone. How can they reach out and connect with you?
So they can either call me at 951-216-5474, or they can email me at Daneen@meridianpayrollgroup.com.
Cool. Thank you. I appreciate the time. I appreciate you always helping us out when it comes to this stuff. We know this is the stuff that for a lot of us, it makes our heads hurt. But we are always glad to have someone like you in our corner making sure that we're doing all the right things. So thanks again.
Thank you.